Today, the world, for the 32nd time, marks the World AIDS Day, but for the first time under unprecedented circumstances, that is the COVID-19 pandemic, a virus that has ravaged countries for the better part of the year and now threatening to erode gains made over the years in the fight against HIV and AIDS. Here in Kenya, latest statistics reveal an alarming rate of new infections among adolescents and 57 deaths daily as a result of HIV and AIDS-related illnesses. On this episode of The Front Row, we focus on Kenya's status report, how COVID-19 has impacted the fight against AIDS, and what the plan is to seal existing gaps. Thank you for joining us on this episode of The Front Row. I am Akisa Wandera, and to be part of this conversation, you can log on to slido.com. Event code is #TheFrontRow. We'd love for you to participate in this particular session. You can also join us on Twitter at Akisa Wandera, at KTN News KE. The hashtag to use is The Front Row, and of course we'll be sampling a number of your views. Any question you have for any of our panelists, I'll be glad to pose that, and of course just take a look at some of your insights as we continue with this program at this particular hour. I'd like us now to take a look at who's helping us dissect a number of these issues on the topic of discussion. We have Rosemary Buru, the Executive Director of Wacky Health, and she is joining us here. A little bit about her: she has a Master's in Public Health from The Ohio University, a Master's in Business Administration from Fortsburg State University in Maryland, currently, of course, the Executive Director of Wacky Health. She also has a Bachelor of Education degree from the Kenyatta University here in the country. So we're glad to hear from her. And of course, some of the efforts and thoughts and insights from her organization and how we're handling the HIV and AIDS, and especially now amidst this pandemic. Our next guest, we have Mary Mugambi, sorry about that, a programs manager in charge of HTS and PrEP section at NASCOP. She has a diploma in clinical medicine surgery, and of course she also has a postgraduate diploma in community health and a Master's in Science Clinical Psychology. She's joining us, of course, from NASCOP, and just taking a look at some of the efforts the country has made and the status report especially. She also has done expansive research on psychology and HIV and AIDS prevention as well as treatment. We also have Dr. Medhin Sehau, the country director, UNAIDS. She was appointed in July of 2019. She's previously served in the same capacity in Zambia and South Sudan, and also served as the Chief of Staff for the Federal Ministry of Health in Ethiopia. So she'll also be joining us to also give us a global perspective, perhaps, to this conversation. And finally, on the panel, we will be joined a bit later with Nelson Otoma, the chairperson of the Network Empowerment of People Living with AIDS in Kenya, NEPAC. He's the director of this particular organization. Will be joining us shortly. I understand he's on his way. And of course, we'll also be wanting to hear more about what NEPAC is doing in this particular issue around HIV and AIDS. So a little bit more will come in the conversation. But we also would like to ask you, is Kenya doing enough to manage HIV infections? Is Kenya doing enough to manage HIV infections? We'd like you to participate in this conversation. Text us on 22155, tweet us at Akisa Wandera, at KTN News KE. Remember to use the hashtag FrontRow for easier tracking of your responses. Before we get to the conversation, the COVID-19 pandemic has had a profound effect on people living with HIV, and it has disrupted the programs fighting HIV and put these people at greater risk, according to the WHO. The Director General, of course, has warned that people with HIV have a higher risk of contracting another disease because of their compromised immune systems. Sada Hassan with more.
There is some evidence that people living with HIV may have an increased risk of severe disease and death from COVID-19.
It is now 36 years since the first HIV case was reported in Kenya. Over time, the disease curve has changed, and now adolescents and young adults are forming a bigger chunk of new infections. Data from the National AIDS Control Council, NAC, shows that 41,728 new HIV cases were recorded this year, 25,062 of them being female and 16,666 male. Children between the ages 15 to 19 years recorded 6,247 new infections, with young adults between 20 to 24 years recording 8,191 cases. Majority of females with 5,166 new infections compared to males with 3,014 new infections.
The COVID-19 pandemic poses a challenge to the uptake of HIV testing services due to low outpatient hospital visits during this period.
Counties accounting for the highest number of new infections include Kisumu, Nairobi, Siaya, Homa Bay, Migori, Nakuru, Mombasa, Kisii, Kakamega, and Kiambu. Nationwide, there are 1.5 million HIV infections this year. Despite the progress made, the country is losing at least 57 people daily to HIV and AIDS-related illnesses, according to NAC. A huge chunk of the death being reported from people between 35 to 49 years. This year alone, 20,997 people have died, with Nairobi registering the highest number of deaths at 1,693. Other counties with highest numbers include Kisumu, Homa Bay, Nakuru, and Siaya. Counties with least deaths include Tana River, Lamu, Samburu, Marsabit, and Isiolo.
Many youths you find they are careless because they don't know their status. But if you find someone who knows his or her status, he will be very careful.
It helps us to know ourselves and help those who have them, to encourage them to take the ARVs.
Ni muhimu kujua hali yako HIV kwa sababu inasaidia ya kwanza unajipanga.
Data from the Ministry of Health shows that testing rates among men lags behind compared to women. The Hiv Self-Testing electronic vending machines have been launched to accelerate self-testing among Kenyans. Brian Ray, the Vice President of AuraSure Technologies, the manufacturers of Aura Quick HIV Self-Test Kits, say that it is an effective way of ensuring your privacy as well as time-conscious.
So the test has been shown to be over 99% accurate. It's highly accurate, and individuals can have confidence in the result. But of course, any positive result needs to be confirmed.
As Kenya joins the rest of the world in marking World AIDS Day, new approaches need to be put in place to address this pandemic. Sada Hassan, KTN News.
Right, let's now get into that conversation. Once again, my guest in studio, Dr. Medhin Sehau, the country director, Hiv and Aids, Dr. Mary Mugambi, program manager, NASCOP, Nelson Otoma, who's on his way, is the chairperson of the Network Empowerment of Persons Living with AIDS in Kenya, or NEFAC, if you like. And finally, Rosemary Buru, executive director, Wacky Health, and they're all joining us for this conversation. Thank you, ladies. Perhaps the gentleman will join us a bit later. I think let's get a quick overview from Dr. Medhin, being the country director at Hiv and Aids, and you know, working around matters to do with HIV and AIDS, and you know, Kenya trying to suppress these numbers, looking at the various reports that we've gotten globally and even locally. Where are we as a country?
Thank you very much for this important question, Akisa. So if I may, the global, when you look at the global
Right, we seem to be having a challenge there, the hazards of technology sometimes. So perhaps you can shoot this question to Mary Mugambi from NASCOP as we try and just figure out what's going on with the network there with Dr. Medhin. I don't know whether we have her clear. No. Let's speak to Mary. Mary, where are we as a country really in the fight against HIV and AIDS? Well, on the other hand, we are getting new reports of high infection rates, and especially among adolescents. Globally, a report shows that Kenya really is among 25 countries that are making progress in the fight against HIV and AIDS. So where are we in this?
Thank you for that question. So as Dr. Medine was just speaking, Kenya is fifth globally, so meaning we are really affected for us to be fifth. And as you rightly said, we have made some progress going forward. We are not where we need to be, but we are making progress steadily. And so as a country, I think we are doing the best we can in looking at the resources that we have. Back to you.
So what is this progress really? And looking at the latest statistics that will be running on our screens from the National AIDS Control Council, there's still reason to worry about the kind of numbers we are getting from there, don't you think so?
Yes, the numbers of new infections are worrying, and considering these numbers are high among the young population who are the future of this generation, of course that is worrying. And then, of course, looking at many things, having a lot of unprotected sex among that same age group. And currently, as we speak...
I can hear, I can speak, I don't know. Is it not stable?
And currently, as we can see during this pandemic, our youth being very idle, those are some of the things that contribute to unsafe sex. But of course, we are making headway by promoting safe sex among youth. It may not be optimum, but of course, there is a lot we are doing within communities to make sure that they have safe sex. We have also brought in the pre-exposure prophylaxis that can be used for those who are at risk of having HIV, even if they don't have HIV at that point. But once we notice that they're at a substantial risk, so we start them on pre-exposure prophylaxis. And then, of course, we have new technologies that are coming in, and once science shows that they're very effective, those are things that we are looking at adapting, like the injectable pre-exposure prophylaxis, the rapirivine ring on top of condoms, and of course, abstinence and being faithful as part of our prevention messaging. Back to you.
Rosemary, speaking yesterday at a function, perhaps a precursor to marking off this day, Wacky Health expressed concern over the kind of numbers we're getting, and especially on the productive age, so to speak. Your thoughts on that?
Yeah, thank you so much for having us on the show. I want to even first begin by acknowledging that on this day, the World AIDS Day, as we commemorate the fight, the science, it is really important to honor and celebrate the people who have contributed so much to the HIV response globally, in the region, and at the country level. It is a day for us to stand in solidarity with people living with HIV. And actually, I would like our viewers to understand that for those of us who are stakeholders in the HIV response, we are very intentional about the language we use. And because of that, it's important that we know that we no longer refer to people living with HIV as people living with AIDS, and the preferred language is people living with HIV. It is very intentional because of issues around stigma, etc., etc. And so we want to celebrate everybody who has contributed to that. And like Dr. Mugambi has said, yes, we have made great strides in the region, in Kenya. You are specifically asking around new infections among young people. I think we want to first acknowledge and appreciate that as a nation, we have made tremendous progress around HIV new infections. About 5 years ago, it used to be like 200,000 new infections per year. It came down to about 150,000, it came to 100,000, 70,000. And today, according to the report by the National AIDS Control Council, the status of the HIV response in Kenya, we can see we have about 40, 41 around there of new infections. So there has been a lot of progress in that front. However, as you have rightly said, Akisa, the biggest challenge right now, which is perhaps where one of the things we need to focus on in terms of efforts, is around the new infections among adolescent girls and young women. And in the function you are referring to yesterday, we had the honor and privilege of having a conversation with adolescent girls and young women to specifically focus on this issue and really interrogate the question of why are we having either increasing infections among adolescent girls and young women, but also as the general new infections in Kenya are going down, the infections among adolescent girls and young women are not going down. And so this is very important for us. And when we look at why is this happening, there are so many factors which I think we should bear in mind and really be intentional about how we focus our efforts as a country, where we invest, given the report that was launched, giving us the current HIV status or update and progress report.
What are these factors that you think really attribute to the rising number of infections among adolescents and young girls or young women?
Yeah, so you can talk about structural challenges or structural barriers. These ones existed even before COVID, and perhaps COVID made it even worse. When we talk about structural barriers, we are talking about access to health services, access to facilities. I do know that around 2010, there was a Ministry of Health study that was looking at health facilities in Kenya. And it was interrogating the extent to which our health facilities in Kenya are youth-friendly, meaning that they can deliver HIV services or basically health services to young people, free of stigma, free of discrimination, and really free of judgment. And according to that report, only 7% of facilities in Kenya were found to offer youth-friendly services. And what this means is that our young people are not accessing health services in the way in the numbers they should. They are not seeking care the way they should because the health facilities are not structured in a way that is friendly to them. And the other reason is, and COVID made that worse because there was general fear around going to hospitals, and so young people as well were affected. The other issue, you could talk about the socio-cultural dynamics that affect young people, adolescent girls and young women especially. When we talk about socio-cultural factors, we are talking about, for example, gender-based violence. We are talking about sexual violence, like rape. We are talking about patriarchal systems that actually are barriers to adolescent girls and young women's ability to access health services, to access HIV services, etc., etc. And within that, there's also another factor, which you can call a socio-economic factor. You find that you have so many adolescent girls and young women who are themselves heads of households. They're leading households, or they are in universities, or wherever they are at their life. You find that they are needing to access livelihood. And because of unemployment, you find a lot of them engaging in transactional sex, which means that they will end up either being exposed because they are unable to negotiate for safe sex, but also because in transactional sex, then that particular activity or experience puts you in a compromising situation as a young person. And so that's also another factor. And yeah.
All right, and we'll get back to that.
If you think about, yeah.
Okay, just finish your point. I think there's a point you're making.
Yes, I wanted to talk about, you know, how COVID-19 kept girls out of school, because school offers some sort of social protection, especially for girls. So having girls out of school, what we know is that keeping girls in school reduces the chances of HIV infection. And so when you have girls dropping out, when you have girls at home, it increases the risk of HIV infection.
All right, now at this point, you've mentioned a number of reasons, and a bit later on we'll be getting into then how do we focus strategies to deal specifically with what we call some of the reasons that we would attribute to the high rates that we are witnessing among adolescents and young girls. Medhin, I believe that we have you now and the network is a bit better. I'd cut you short when you just begin speaking, so I'd give you a chance to just give us an overall overview of where we are as a country in the fight against AIDS. And given that this 32nd celebration of marking of World AIDS Day comes amidst a pandemic, how are we doing as a country?
Thank you very much, and apologies for the technology hiccup. So I was making reference to the global level of the pandemic, where we have about 38 million people living with HIV. And out of this, still around 12 million are waiting to access treatment services. When we look at the number of new infections, just in 2019, we have had 1.7 million new HIV infections. And who are getting infected? Especially the adolescent and young people, and more the adolescent girls are getting infected. And that is what is really contributing to this high number of infection rates. Coming back to Kenya, I think colleagues have mentioned earlier that we have an estimated number of 1.5 million people living with HIV in Kenya. And when you look at the number of new infections happening every year, they are around 40,000. And looking at, again, who are getting infected, it's mainly the adolescent and young people. And you summarize like 42%.
Well, looks like we are a bit unlucky with the network today, but once again, the hazards of technology. We'll be getting back to Mehdi. Dr. Mehdi is the country director at UN AIDS, and of course just setting up the pace for us there with the numbers. 1.7 new HIV infections, most of it attributed to the younger population, what many would describe as the productive population. And Mary, you talked about some of the interventions, specific interventions we're making as a country to just try and bring these numbers down or manage this situation. Even as we mark this day, we've seen efforts around the self-testing kits. Will you talk to us about that?
The people who don't ordinarily get to health facilities so that they can know their status. And today we launched the vendor machine, and with the vendor machine you can be able to access the self-test through a machine. You can also be able to buy the self-test online. You can also be able to buy through the pharmacy program. Pharmacists are selling, and pharmacists have been trained and can give you guidance on how to use the self-test. We also have our 1190 number, which you can call so that you can get support. We have also our Be Sure app on Play Store that you can be able to download on an Android phone. And using Uber, using Boda, and whatever other means of transport, you can be able to go and buy your kit. And also for referrals and confirmations of HIV status can also be done using the same mobile technology. So that is okay, that can be used. And remember, you can use a self-test from 18 and above. For those who are below 15 to 18, we support them by giving them assisted self-testing, so that a provider who is trained is assisting the adolescent how to carry out the test. Back to you.
Well, and once again, I'll keep making reference to the fight against HIV and COVID-19 a lot, because we find ourselves in unusual times, so to speak. Even at NASCOP, looking at the last perhaps 8 months that the country has been battling COVID-19, how has this directly affected the fight against HIV and AIDS? And even as we come up with this new ways of managing, what are some of the challenges or some of the loopholes that have been created by this pandemic? Mary Mugambi.
Thank you. So when COVID-19 came, I could say we were all caught not very well prepared, because eventually people were coming in from the country, and majority of us health workers had to go and work in the quarantine centers. But as NASCOP, we were able to move in very fast and give information, because information is power. So we were able to set up the call center with the help of Safaricom and the National AIDS Control Council. And we were giving information on COVID-19, the facts, and a lot of people were calling in at that time. And so giving information on COVID-19, who can get COVID-19, what are the signs and symptoms, that helped alleviate some of the worry that was among the public. The Ministry of Health also went ahead and developed a circular on how services are going to be run despite having COVID-19. And we are giving 3 months dispensing for ARVs for all our patients so that they do not have to keep coming back to queue. Also for pre-exposure prophylaxis, for those whom we are able to establish that they are still negative, we still give them their pre-exposure medication. So we have made sure that people are not missing out their medication by doing that. And of course, enhancing adherence through community health workers who give reminders to our clients using SMS and many other technologies so that we just ensure that they come in for their medication.
There have been
other things that...
sorry, let me just cut you short for a bit. There have been complaints that in some hospitals or health facilities in this country that have run out of ARVs, some say they've not been able to access treatment. We are aware that in some circumstances, the present infrastructure for HIV and AIDS had to be used for COVID-19, and understandably so, because we are dealing with a new thing and swelling numbers by the day. Perhaps your response on that?
I'm not aware of facilities that missed out on ARVs because we haven't received any stockouts. But I wouldn't be surprised if some of the patients didn't go to pick their medication in fear of contracting the virus. That is possible, but we have made arrangements for them to be contacted at home on phone so that they can come and pick their medications. Of course, there's a strain on the health workers because now the health worker has to have a mask. The health worker has to, maintain distancing and all that. So, of course, we had to do a lot of training on Zoom for our health workers so that they can be able to prevent themselves and feel confident that what they are doing is right. And, of course, enhance the messaging so that we ensure that our health workers are protected. But of course, we also have things like not having enough masks, and that has been reported and established, but it's been worked on.
Right.
Back to you, Aki.
Right. Thank you. That covers it, perhaps. Earlier on, you'd spoken about, and this is to you, Rosemary, on some of the barriers to especially access to treatment and the preventive measures, perhaps, and especially for young people. Is it then time we reimagine response, and especially among children and young people?
We really need to focus on and be very intentional in terms of how we make investments, that is resource allocation, to really target adolescent girls and young women. And you also mentioned children. I know with children, that is also another area where, as a nation, we really need to put much more effort. We still have quite a bit of transmission from mother to child. According to the report, we have about 4,200 annually, which is still not acceptable because we shouldn't be having any child being born with HIV infection. And so that's an area to work on. But coming back to adolescent girls and young women, it is very important to also understand that at the moment, when we talk about HIV prevention options, we don't necessarily have HIV prevention options that are targeting or that can be controlled by adolescent girls and young women. The prevention options that exist are prevention options that actually center on the dynamics of the politics of power, the issue around disclosure, etc., etc. So if you look at the prevention options that exist right now for HIV, it's male circumcision, it's male condoms, it's PrEP, etc., etc. One of the things that scientists have been doing is to work around identifying a prevention option that could work for women, which is what we call women-initiated prevention methods. And that is why yesterday we were talking about the possibility that we could have that, and that is the vaginal ring, which really has made great advances. We know it has been given a positive approval by the European Medical Association, which means it can go forward to regulatory authorities. And yesterday there was also great news because the World Health Organization also pre-qualified the ring. And what that means is that Kenya, for example, as a country, can begin conversations on how they could regulate this particular product that then places choice in the hands of young women from age 18, and they can make choices about their own protection, they can make choices about their own safety. So there are those mechanisms that are coming up in terms of how adolescent girls and young women can do that. But also very important for our country, I must mention about sexuality education. I know it's a very controversial topic in this country, comprehensive sexuality education. But why it's important to mention this is because the more a young woman is empowered in terms of understanding when they need to say no about sex, when they need to negotiate for safe sex, the more they are actually able to get out of risky situations. The perception we have here in this country is that when you expose young people to comprehensive sexuality education, you are actually providing them with unnecessary information. That's the perception. But actually you're empowering them to make decisions about their own sexuality, which could actually save them from HIV infection, save them from early pregnancies, and just give them make informed choice. And so that's something to actually look at. And the other thing is, like I had mentioned, we really need to invest in youth-friendly services and facilities, and not just building the structures. It is also investing in healthcare professionals, so that when young people show up with certain situations, we are not judgmental. We are not asking them, why are you doing this? We are not asking them, why do you need this? But actually, we are offering services that is people-centered. You are thinking about the person first before wondering what have they been doing with their life. And so this is one of the things that can greatly help to improve and really ensure that we are controlling new infections among adolescent girls and young women.
Dr. Medhin, there's a long list of challenges that are threatening to derail the efforts that have already been put into managing HIV and AIDS, and the COVID-19 pandemic, as almost all our panelists have mentioned, is one of them, and the most immediate right now. How much does this threaten the gains that have been made over the years?
Thank you very much once again, Akisa, and sorry, the technology, I think
it's understandable.
It's
understandable.
Yeah. Yeah. So just to briefly mention where is Kenya in terms of the response, I think when we look at the 1990 cascade, Kenya was right on track towards achieving, the 90 targets. So right now it's at 76, meaning the first 90. Knowing one's HIV status, then those on treatment 89, and the viral suppression is at 90. So this is a national average. But when we look at or disaggregate the data, I think children are lagging behind. We are failing children, and it's very important that we focus and make sure that children access treatment services so they can also be virally suppressed. That is very important. What I was trying to mention earlier is the rate of new infection among adolescent and young people that contributes 42% every year. So this is really a lot, and we need to pay attention to that. But coming back to the challenge, yes, we are dealing with colliding, two pandemics, COVID and HIV. And as Mary was also mentioning earlier, when we were hit with COVID in March this year, obviously everyone was trying to make sure that, we contain the spread of the virus. So there was a kind of, reprogramming, repurposing of the infrastructure, human resource. So that has kind of, derailed a little bit attention from providing, the services. But as much as COVID has caused challenge, I think it also brought opportunities so that we can look into what innovative approach should we use to make sure that we sustain the gains that have been made over the last 4 decades, but also to make sure that those who do not know their HIV status get tested and know their status and access treatment services. Like today, the vending machine that was launched in Kajiado is basically, to make sure that those who are probably fear of stigma, discrimination, they have the opportunity to have access directly to the self-testing kit, and they would know their status so that they can be counseled and access to treatment services. So obviously there are a number of challenges, but I think Kenya, out of the 1.5 million people living with HIV, currently close to 1.2 million people are on treatment. So this has been made possible with the concerted effort of everyone, government leadership obviously, and civil society, community partners together. And I'm hoping that we can cope up and make sure that Kenya achieves the fast-track targets and even go beyond to make sure that we are moving towards ending the AIDS epidemic. But one thing on the adolescent girls, the evidence is showing that if we can keep girls in school, at least until they finish high school, we are already reducing new infections by 50%. If we add on top of that access to sexual reproductive health, knowledge, the comprehensive sexuality education, reducing gender-based violence, I think we can go up to reducing by 80%. So it's a kind of a combined effort that we need to make, because there is no any single bullet that can address all the challenges that people are facing, because this is structural, social, cultural issues. And that's why, in fact, the theme of this year's World AIDS Day is global solidarity, shared responsibility, meaning it's not only government, it's not private sector, but all of us have to really do our part to make sure that we are fighting both COVID and HIV. Thank you. Over to you.
You started by saying that this has presented challenges and unprecedented ones, but also that this presents an opportunity for us to perhaps refocus our health systems, I'd imagine. But Kenya is also in a conversation on rolling out the universal health care. So when we talk about perhaps concurrently dealing with HIV and on the other hand dealing with COVID-19 in the focus of UHC, if I could put it like that, what are some of the opportunities that we can leverage on to ensure that we deal with these two concurrently, and at the same time we are strengthening our health systems and our health infrastructure? Dr. Medin.
Okay, thank you very much. But Kenya's political leadership has been on top of fighting, especially COVID. And before that, we know His Excellency, the President, has launched the Big Four agenda, as we all know. And one of the Big Four agenda is implementing the universal health coverage. So even before we experienced COVID, this has been, on the political agenda. We know there has been a pilot in 4 counties, and based on the lessons learned, to roll out across all the 47 counties. So I think this has been really a great opportunity to see how can we have an integrated approach, because we are not dealing with HIV on this side, then we have TB, malaria. At least these 3 diseases are the major causes of death in the sub-Saharan, including in Kenya. So the universal health coverage has really been an opportunity to integrate all the services and making sure that all people, regardless of where they are, who they are, whether they have enough money in their pocket or not, they will be able to access services. And COVID, we have seen national government, county governments, the whole government approach working together to ensure that all the counties have the capacity to respond to COVID, but at the same time keeping, the essential services, including maternal health, child health, immunization, HIV, TB, and so on. As I said, yes, initially, like in March, April, it was new. No one was prepared, not only in Kenya, even the world. The most developed, the richest countries were not ready. Up to now, we can see how much they are really suffering from COVID. But I think, as I said, this has brought a new opportunity for everyone to work together, especially national, county level, and we know how the health system is being, strengthened. That will be now a very good foundation for effective implementation of the universal health coverage. I know the policy is ready, the health package, the essential health package is also being finalized, and we are optimistic that Ministry of Health will now, integrate everything into the universal health coverage so that people can have access to services. We know the reform of the NHIF is very critical for the UHC to be, effective. But I think, Kenya is on the right track, and we are optimistic that with the full scale up of UHC, we'll be able to cope up with, the gaps that we have experienced towards the 1990, but also ending the epidemics by 2030 as part of the Sustainable Development Agenda.
All right. A question on how practical is it and whether we would be able to end this by 2030. We'll get back with that. I want us to take a quick break, but before that, a comment here on Twitter from Koa Frederick, who says, as it stands, COVID-19 is here to stay, and so is HIV and AIDS. It would be important that we as a country can be able to address these two concurrently and make sure that the milestones made in the fight against this are not HIV and AIDS are not overrun by the COVID-19 pandemic. Keep those comments coming. We'll be taking a look at a number of them, and whether you have questions for our panelists, I'll be posing them when we get back from the break. You're watching The Front Row. Stay with us. We still have a lot more lined up for you.